Hi, this is Mrs. Lewicki, and I'm talking about renal and hemodialysis, and this is part 2 of 5 presentations. This part is going to mostly talk about renal failure. Renal failure is when you have partial or complete impairment of renal function. It's classified as acute or chronic. Acute renal failure is a rapid onset, and chronic renal failure, it develops slowly over months to years. In another presentation, we'll talk about the stages. This is a chart comparing acute kidney injury to chronic kidney disease. Acute kidney injury is previously known as acute kidney failure. It's a term used to encompass the entire range of the syndrome, including a very slight deterioration in kidney function to severe impairment. AKI is characterized by acute loss of kidney function. The loss is accompanied by a rise in serum creatinine level and or a reduction in urine output. The severity of dysfunction can range from a small increase in serum creatinine or reduction in urine output to the development of azotemia, which is an accumulation of nitrogenous waste products, BUN in other words, and creatinine in the blood. AKI can develop over hours or days with progressive elevations of BUN, creatinine, and potassium, with or without a reduction in urine output. Acute kidney injury or acute renal failure is, as we said, rise in serum creatinine and or reduction in urine output. Can go to progressive azotemia, increase in urea and nitrogen waste products, increase in creatinine. When it reaches a uremia, that means we have multiple body systems affected, develops over hours to days, and most commonly follows an identifiable hypoperfusion event. Sorry, there's a spelling error there. So what that means is that there's a period of time when the kidneys were not getting enough blood, such as hypotension or hypovolemia. Causes are multiple and complex. We refer to them in terms such as prerenal failure, intrarenal, and postrenal. Prerenal, if you think of pre is before the kidneys, and in the case of the kidneys, what comes before the kidneys is the blood, the aorta, and the blood flow to the kidneys. So that would be your hypoperfusion or your hypovolemic event as causes, and we'll talk about those separately. Intrarenal is within the kidney body itself, and postrenal is after the kidneys, which would be ureters or bladder, is what comes after the kidneys. I just talked about this, but prerenal, sudden, severe, and drop in blood pressure, shock, or interruption of blood flow to the kidneys from severe injury or illness. Intrarenal, direct damage to the kidneys by inflammation, toxins, drugs, infection, or reduced blood supply. And postrenal are anything that's going to obstruct the urine flow. A large prostate, kidney stones, bladder tumor, or injury to the bladder or the tubules. Prerenal is due to factors external to the kidneys, reduced blood flow with decreased glomerular perfusion and filtration, things such as hypovolemia, decreased cardiac output, decreased peripheral vascular resistance. They can lead to intrarenal disease if ischemia is prolonged, and accounts to over half of all acute renal failures or acute kidney injuries. Intrarenal is from direct damage to the renal tissue, 35 to 40% of all acute kidney injuries. Anything that causes prolonged ischemia, such as decreased perfusion. So it may start out as prerenal and end up being an intrarenal. Other things that are solely intrarenal are nephrotoxins. So aminoglycoside antibiotics, contrast media, those can cause intrarenal damage to the kidneys. and hemoglobin or myoglobin. Things such as hemolyzed red blood cells, rhabdomyolysis. So when we talked about blood transfusions, and I said we needed to make sure that the filter was covered before we were giving it, because that process would cause the red blood cells to hemolyze and break down. That can lead to kidney failure. Same thing with muscle breakdown. The release of muscle breakdown is rhabdomyolysis. And if you remember, I told you that those molecules are pretty large. Even sepsis has really large molecules. And what will happen is they can obstruct the capillary bed because they're very large molecules. Other things, necrotic muscle cells, block tubules, and cause renal vasoconstriction. Acute tubular necrosis is a form of intrarenal, or is a form of acute kidney injury caused by ischemia, nephrotoxins, or pigments. And ischemic and nephrotoxic ATN is responsible for 90% of all intrarenal acute kidney injuries. Postrenal is anything that occurs, like I said, after the kidneys, and that's usually a mechanical obstruction of urinary outflow. That's less than 5% of all AKIs. Increased pressure in the renal system, such as prostate cancer, enlarged prostate, calculi, trauma, extrarenal tumors. Postrenal ARF is usually treatable before permanent damage occurs because we release the stone or fix the prostate. This is just a picture showing stones in the ureters. And then this is listed as clinical manifestation. But Reifel criteria is how it's determined the level of renal failure that's occurring. And that's risk, injury, failure, loss, and end-stage kidney disease. And what that shows is a change in your urine output or a gradual decrease in that, and your GFR and your creatinine.